Welcome students and viewer to this fresh new lecture of the day. What you can see on the screen is a coal mine, and there is a crane on the top. I point out to this crane that is commonly used for mining the coal out of the mines. People who work here usually suffer from a physical problem, and today we all are here to discuss about that problem, to gain some knowledge of that problem. The name of the problem is coal miners pneumoconiosis. Why? Because this disease is mostly found in the people who are involved in the profession of coal mining, and these people suffer from a lungs disorder. So let us now take a look of the definition of what coal mining pneumoconiosis is all about. As far as a popular textbook, it is defined as that it is a type of pneumoconiosis caused by inhaling respirable coal mine dust. That means when the people into this profession do inhale some very small respirable particles. Now, what is a respirable particle? Particles of that size which can reach to the terminal bronchi of our lungs. People who are not that aware of what terminal bronchi are, I'll be instructing those people to refer to my other videos to gain a very clear idea of the concept of the terminal bronchi. Now, any dust that can reach those parts of terminal bronchi are known as respirable dust. If this respirable dust is coming from the coal mines, we call this as respirable coal mine dust. If there is a continuous and prolonged inhalation of this kind of dust, the lungs do develop a problem, and that problem is known as coal workers pneumoconiosis. Another name for coal workers pneumoconiosis is coal minus pneumoconiosis. So these both two things are the same thing. In the question you find I have written here as coal minus, but when I am answering the question I am using the word workers. So workers are basically those persons who are into the work of mining the coal. Okay. There is another word that has been given in the definition, that is called the black lung. We will come into the later part of this video why the lungs out here is known as black lung. Let us proceed to learn the reasons. So the lung is black. Now the area where the workers were in the coal mine is also black, isn't it? What you can see in the diagram is various people who are into the coal mines, working in the coal mines, some women carrying coals over their head. This man is trying to break a big chunk of coal. This man is arranging small pieces of the coal onto the buckets which this woman will carry. So these are the various kinds of work that I've found people doing in the coal mines, but each and every of this kind of work do generate some amount of respirable coal dusts, and it is from this respirable coal dust that we get the problem known as the coal minus pneumoconiosis. What is the common sign and symptoms? Initially, I must mention that initially there are no sign and symptoms of this disease, but though the disease is developing insidiously inside the lung. But when the signs and symptoms finally get manifested, a very short list of such signs and symptoms are given in front of you. First is a cough. With the cough, there will be a black sputum. As you can see in the third point, I've given coughing of black sputum. This kind of black sputum is known as melanophthisis. Melano is a prefix that is used to refer something that is black in color. Phthisis is the suffix for the phenomena of cough. So melanophthisis means coughing of a black sputum. Additionally, since there is a problem of lung, there obviously would be a shortness of breath. As the problem will increase, the shortness of breath will also go on increasing. And final thing here out is the chest tightness. Difficulty in breathing would lead to the tightness of chest. So these are the signs and symptoms. Now what actually happens in the coal miners pneumoconiasis? If we examine the lung, what is found is given here, named as the coal macule. The coal macule can be seen on a macroscopic examination as a small pigmented lesion. Pigmented means the lesion is having a color, and the color obviously is black because the coal macule consists of coal dusts. This pigmented lesion, that is known as the coal macule, is initially distributed in the upper lobes. Upper lobes are found on both the sides of the lungs. Initially, though, distributed in the upper lobes, but subsequently, that means in the later stages, the lower lobes become also involved. Now, if we put on a microscope or under a microscope some amount of tissue of this lung, we can observe this coal macule. What we see in this coal macule, that there is an aggregation of dust. It is given here as stellate aggregation of dust, and along with the dust there are dust-laden macrophages around the respiratory bronchioles. So the macrophages tries to engulf within it the coal dust, but the macrophages fails to get rid of that coal dust. So the macrophages become dust-laden macrophages. And the dust-laden macrophages, along with the dust itself, are found aggregated around the respiratory bronchioles. These aggregations are termed as, have a look again, this is the coal macule. Now, around the respiratory bronchioles, additional thing that those are found are the reticulin fibers and a variable amount of collagen. So this is the pathological finding of a coal minus pneumoconiosis, coal macule. So after we looked into the pathology, it's now time to take a very short video to demonstrate the way the disease develops inside the body of the patient. So what actually happens inside in CWP? We shall be playing this short video to find out the exact mechanisms by which the coal dust produces the disease. So what you see out here is the coal dusts, and that coal dust has been inhaled. After inhalation, the coal dust is deposited inside the lung. This kind of deposition is the point from where the coal macules develop. So when we are inhaling, let us have a look on the video more closely. We are inhaling through our nose, and along with every inhalation, see, the dusts are coming inside, and also is moving out during exhalation. So as the material comes in, it leaves the dust within the lungs, and the lungs progressively accumulates this dust. Now, since the color of the coal is black, finally the lung itself becomes black, as can be seen on the screen right now, and it is exactly for this reason that the disease is also termed as black lung. Have a look. This is the lung, which is exactly full black in color. These blackish areas are the areas where there is high density of the distribution of the pathological structure called the coal macules. Since we have seen the way in which the disease develops inside the body of the patient, in the lungs of the patient, the coal macule is developing, but obviously we are not going to find out the exact developments in the lungs because it's not always possible to perform a biopsy, and biopsy is not the first option for diagnosis also. What is the first option for diagnosis is a chest radiograph. So now we should be looking into a chest radiograph and to try to compare the radiographs between a normal lung. See, in 1988 the lung has been imaged, and this man has been working in a coal mine. So after working for a few years, on 2001, that same person's lung has been imaged. Now let us have a look on the developments of this lung. You see the black areas are much more predominant. Do not confuse this. These blackening are the normal blackening because lungs in a normal chest radiograph is black. But that same black areas has transformed into whitish masses. These white areas are those areas where radio opacity has developed. What exactly is radio opacity? That is beyond the course, that is beyond the scope of the present discussion. We shall be referring to what radio opacities are when we will be discussing different radiographs of chest. As of now, just know that these are the areas where cold macules has developed, and the cold macules doesn't allow the X-ray to pass through it, and that is why on the X-ray image we find that this area has become white. But if you check a few years back radiograph, you will find that these areas are not that white. So this actually is a big problem, and then comes the obvious question that whether this disease is curable or not. We shall be taking a short look into this slide. It has been said that there is no cure. I emphasize again that there is no cure for black lung disease. So treatment usually focuses on relieving symptoms and improving the quality of life. A black lung treatment regimen will vary based on whether the person has a simple or complicated form of CWP and what specific symptoms are being experienced. So treatment is basically directed towards the symptoms, not the disease itself. Generally speaking, medications and supplemental oxygen may be used to improve breathing and control coexisting symptoms from related conditions such as chronic obstructive pulmonary disease. But if all these things fails, as in the case of many other pneumoconiasis, the last option that is available is a lung transplantation. So it is recommended for patients with a very severe cases of black lung. So with this very short description of the coal miners pneumoconiosis, as far as will be required by the students of hospital management under MAKAUT, we shall be putting an end to this discussion. Thanks for watching. Here is the WhatsApp number given to you for sending me any suggestions as well as any feedback. Hope to meet you soon with another new video on a different pneumoconiosis. Thank you. Thanks for watching.